Hello everyone, my name is Rohith Verghese, and this will be my leading change assignment. Starting off, I wanted to talk about the population of interest. So the population that I was most interested in during my nursing student years has been pediatrics. This is because of three different reasons. I have a lot of experience working with children and young adults, whether that be in the clinical setting, but also outside, such as in my church's Sunday school program. I am very interested in the growth and development aspect of children. If I find it really fascinating and interesting to learn about it. And I also have a long-term goal of being a mental health nurse practitioner that deals with childhood trauma and other problems that are present in the pediatric population. So what I want to do is to be a guiding hand for kids that don't have that in their childhoods. So these are the four topics that we'll be going over in this presentation. First of all, we'll be going in change of perceptions that I've had, healthcare issues, interventions, and promotion and implementation for those healthcare issues. Let's start off with the change in my perceptions. Throughout my student nursing journey, my perceptions on the pediatric population and the care they need has vastly changed. I now believe and understand that enough is not being done currently to help children get the treatments and assistance they need, especially because of the subpar healthcare system and economic disparity that is present in the United States. I also believe that enough isn't being done to protect and help these children that are facing mental health problems. I thought mental health was high on the list of priorities for healthcare before nursing school, but I learned that it's quite often not and left at the bottom. Moving on, we're going to be talking about the healthcare issues that I'm interested in. So the biggest healthcare issue that needs to be addressed for the pediatric population is the introduction of better mental health support for them. I've come to learn that a lot of children are silently suffering in different ways without being given any relief. Far too often, healthcare workers and adults in general ignore what children are experiencing and the difficulties they are facing. During my mental health clinical rotations at the Menninger Clinic and at the Harris County Psychiatric Center, or HCPC, the greatest lesson I learned was that most of these children were facing the problems they had because of having low quality parenting and even abusive parental relationships. In the United States and across the globe, children are not receiving and being offered the opportunity to discuss their problems and be taken seriously like adults. Continuing on with these issues, according to an article titled Childhood Abuse and Lifetime Psychopathology in a Community Sample by Harriet L. Macmillan et al. In the American Journal of Psychiatry, those reporting a history of childhood physical abuse had significantly higher lifetime rates of anxiety disorders, alcohol abuse and dependence, and antisocial behavior, and were more likely to have one or more disorders than were those without such a history. This shows us the importance of getting these children the help they need as soon as possible so that their growth and development isn't affected and so that they can live as proper adults. Moving on, we'll be talking about interventions. From my understanding, having healthcare systems care more about children and the difficulties they are facing will allow them to grow up with better chances of living healthily. This means that children need better access to therapy and healthcare professionals that can help them. Our current healthcare system in the US also needs to be completely revamped so that money isn't an issue for individuals and families that are seeking healthcare. If children or adults need any type of medical help, they should be able to get it with little to no cost. Moving on to promotion and implementation. The way we can get to this point and start giving these children the assistance they need is by first gathering support for it. The more people that we have caring for an issue, the better the outcomes will be. In order to do this, nurse leaders should be informing and teaching their team members about the importance of bringing about change. We need to show everyone the need for change and how the lack of proper mental health care in the pediatric population will make the future worse. From here, we can create effective teams that can reach out to hospital management to gain more traction and to bring about some changes within that hospital. Once that happens, the goal will be to have these ideas spread to other healthcare and hospital systems until it's something that is naturally implemented by all. This is all in the United States and then the world. Continuing forwards, despite all this work and the raising of awareness, various barriers can hinder progress and stop us from helping the pediatric population. This includes financial limitations, lack of support by team members in the unit, lack of support by leadership, lack of support by the public, and lack of motivation. Like always, these various barriers and many more can stop us from enacting change. But the only way to overcome these difficulties is to be determined in our resolve. The individuals involved should be rock solid in their belief that access to better mental health care resources in the pediatric population will be needed. This also means that we should be able to take time out of our busy lives to work on these ideas outside of the hospital setting. We should also steel ourselves to the backlash that might come our way from raising these issues. Obstacles will always try to stumble us on our path, but we need to keep going till we reach our goal. All this means that we should be ready to organize protests, create outdoor informational sessions for the public, spend our own hard-earned money, and use other peaceful measures to bring more awareness to the topic and bring children the help they need. The most important part that the nurse leader needs to emphasize is that change occurs slowly and shouldn't be expected to just happen. Without constant perseverance, nothing will be achieved and children will continue to suffer in silence. As the nurse leader, we need to show everyone else the courage that is needed to stand up to the healthcare industry and even to our own government, because any change that we make will help some poor kid in the future. Thank you.